what you do during your breaks matters. You should be selecting activities that fit with your passion and interest, and something you can write your essays about for application materials. GPSA is such a program. It's a very good one. There are plenty of them, but it's a very good one. It's mostly for those interested in medical or health occupations. My occupation, for example, biomedical engineering, nursing, doctor, pharmacist, etc. So I've been running this program now about 13 years total. This is a little bit out of date. And undergraduates in this program I'm talking about now is for the undergraduates. About 6,000 pieces of medical equipment have been put back into service. That's millions of dollars of medical equipment being put back into practice by students. Now let me talk about my laboratory. My laboratory is called the Developing World Healthcare Technology Laboratory, the DHT Lab. And as I said, we focus on medical equipment in the developing world. Just to start off, to give you a flavor for this, this is a quote from the Director General of the World Health Organization. She said 70% of critical medical equipment is not working in the developing world. She also said 10 to 30% of donated equipment is not working. So that gives you a pretty big range. The actual number is probably around 50%. I'll show you some data on that in a minute. But either way you look at it, this is a huge problem. And you really need to think about it for a minute. When you go to the doctor here in Singapore, you expect the doctor to be able to take your temperature, measure your height, your weight, blood pressure, maybe take blood, other kinds of clinical laboratory tests might be run on you, look in your ears, look in your eyes. None of that is possible here. 50, according to her, 50% of it, or 10 to 70% of it is impossible. And think about that from your perspective as a patient. If you go to the doctor and the doctor can, let's say, measure your weight, but not your height. Take your blood pressure, but can't look in your ears. Can look in your eyes, but can't take blood. You know, could you really get health care in that situation? And that's what an African citizen faces every day. That's what most of our Guatemalan patients face every day.